Spironolactone and hair loss. What do you need to know? Hi everyone, this is Dr. Blake Bloxham and I'm here today for Hair Restoration Tour, and we are talking about spironolactone and hair loss. So first things first, what is spironolactone? So spironolactone is a prescription medication that was actually initially designed to work as a diuretic, as a medication to help the kidney release excess fluid. This was used for people that had conditions that were causing their body to retain fluid. Maybe their kidneys weren't working as well as they wanted to, and that's what this medication was initially designed for. Now, what the doctors found out over time was that this medication also had some pretty decent anti-androgen effects. That was some sort of secondary effect they weren't expecting, but they noticed that it had some anti-androgen effects. So it has been used for a long time off-label to treat things that are androgen-driven, particularly androgen-driven acne, a very common form of acne, and also androgen-driven hair loss. So this medication has been used for a long time off-label as a hair loss treatment. How does it actually help as a hair loss treatment? So as I mentioned, it is an anti-androgen. However, that's a little bit of a vague term. You can have medications that are anti-androgen and work in different ways. So the way that spironolactone works specifically is it is an androgen receptor blocker. So if you have, for example, in your follicle, androgen receptors. These are receptors where the androgen hormones, particularly DHT or dihydrotestosterone, that's the hormone that typically drives male pattern hair loss. If you have this androgen receptor in your follicle and an androgen like DHT binds to it, that's going to kick off that hair loss process. If you take a drug like spironolactone, it's going to bind on that androgen receptor and it's not going to allow the DHT, for example, to bind normally. So by binding to that receptor in DHT's place, it's going to prevent the DHT from kicking off that hair loss process. We know how spironolactone works, we know what it is, so the big question is it safe to take? So generally, spironolactone is a pretty well-tolerated medication. It's been used for a long time. It's been used in millions of people possibly. So yes, it has a pretty well-studied and pretty well-accepted safety profile. However, it's important to understand that it is a prescription medication. This isn't something that you should just order off the internet. This isn't something that you should just take because you read something on Reddit about taking spironolactone. This is a medication that is a prescription medication. It has a number of different indications. It could do different things in your body. So while it is generally safe, this isn't something that you should just go out and take. And now, who should take it? So spironolactone, as of right now, even though it's off-label, is really only recommended for female patients with female pattern hair loss. And the reason why is because spironolactone, as we discussed before, blocks the androgen receptor. Now, the problem is that you only want this medication to block androgen receptors in the scalp. But when you take a medication like spironolactone orally, it's going to go all throughout the body before it makes its way up to the scalp. If you're a male patient with androgen receptors all over your body, it's going to be a problem for you if you block all of those receptors or a good number of those receptors. You're going to have a lot of negative side effects, and that's going to lead to some problems. In female patients where they don't really want as much of this androgen, driven response, they maybe don't have as much of these androgen receptors. Their hormone profile is more of the estrogen-based hormones, that's not going to be as big of a deal for them. So typically females with female pattern hair loss can take spironolactone, and it's really not as big of a deal for them. They're not going to experience those side effects. And so what are some of these side effects? So typically the side effects from spironolactone are going to be things like you can have some frequent urination because, again, it works on your kidneys to sort of flush fluid. You may have some blood pressure issues if you lose too much of that fluid and all of a sudden your blood pressure gets a little low. You can have some electrolyte imbalances, particularly with potassium, which is a very important electrolyte, and you want to keep that balanced in your blood. And then you can also have some estrogen-related, like anti-androgen effects from it, such as things like breast tenderness in females, for example. Okay, so will spironolactone cure hair loss? So you're a female patient, you're taking the spironolactone, you're very excited for this. Is it going to cure your hair loss? So unfortunately, no. Spironolactone is not going to cure your hair loss. What spironolactone can do is slow the process down. It can kind of stop if you have an androgen-based female pattern hair loss. It can sort of really help kind of keep the enemy at the gate slow this process down. But remember, much of this is genetic, and usually the body kind of finds a way to get around these medications. So it's gonna help slow things. It's gonna help make the hair look healthier, really sort of keep this process at bay, but it's not gonna change your genetics, and unfortunately spironolactone will not cure your hair loss.